Thomas, and I'm going to be doing the return for the peripheral IV infusion. For starters, I would follow the 6 rights of medication administration, which is right patient, right medication, right dose, right route, right time, and right documentation. I would then go ahead and check the orders, the physician orders with the MAR. In this case, with this patient, the physician has ordered, or the provider has ordered, an IV of normal saline, 1,000 milliliters to infuse over 6 hours. That would equal out to be 167 milliliters an hour, with the drop factor being 10, so that'd be about 28 drops a minute. So then I would go ahead and get my solution, my IV solution, and ensure that there's no particles and no, break in the bag. Check the expiration date, and everything looks good with this one. So then I would go ahead and obtain my catheter needle. I would choose the gauge based on the medication that's being administered, the age of the patient, and that information. Would then get my tubing and have all of that ready. So then I'd go ahead and enter my patient's room. I would first off introduce myself to the patient. My name is Lindsey Thomas. I'm going to be your nurse today. Your provider has ordered a IV to be placed to rehydrate you with normal saline. And so that's what I'm going to go ahead and do. I would identify the patient by 2 identifiers, their name and their date of birth. I would then ask for their allergies to ensure that there's no allergies involved with this procedure. I would determine if they've had IV placed before, and then I would explain the procedure. A needle is placed in your vein with the catheter, and we then infuse solution from there. I would go ahead and prepare or wash my hands. I would perform hand hygiene, and then I would label my bag with the patient's name, the drug, which is the normal saline, the amount, which is 1,000 milliliters, and then my initials, the start time, which we're going to put 6 o'clock, 600 hours, the date, and then the flow rate is 167 milliliters an hour, and then the end time, which would be 1,200 hours. And then that's going to go on my bag of solution. And I'm going to open my package of tubing. I'm going to spike the bag. Making sure to keep the ends sterile, both the IV and the spike. I'm going to hang it on the pole over here. Prime my tubing to about half full, and close my lock. I should have closed that in the beginning. Tubing, my cap to prime the tubing. sure that there's no air bubbles. So that doesn't. Place the cap. And I'm going to again wash my hands. Go to my patient. I'm going to apply a tourniquet so I can find the right vein about 4 to 6 inches above where I'm planning to insert the catheter. So I would palpate. If I couldn't find a vein that was dilated enough, I would have the patient squeeze their hand or apply a warm compress. I could also gently rub the vein from distal to proximal. Once I've found the right vein, I'm going to remove the tourniquet and I'm going to get my supplies ready. So I would get my needle, my saline lock, my clear packaging, or my clear dressing, the gauze, my alcohol swabs, and my saline flush. I would then apply my gloves. And I would get my tape ready. Create the chevron. That's ready to go. Okay. And then I'm going to reapply the tourniquet to the patient's arm. And then I will use alcohol swab to swab the area. Going to swab in a circle and then go up the vein. And then I'll give that enough time to dry. Get my catheter ready. Cap. Sure, bevel is up. Insert the needle. Hook. Advance the catheter.